Welcome back to the ElderTree course on living well with chronic pain. In Lesson 3, you'll learn why experts say that movement really is medicine and why it's essential to make exercise a regular part of your pain management plan. For people with chronic pain, the idea of movement or exercise can be scary. You may believe that movement will cause more damage to your body. But over time, avoiding movement can get us stuck in cycles that can make pain worse. Luckily, it's possible to get unstuck, and the brain has more to do with this than you might think. In this lesson, you'll learn answers to these questions. Why is movement important? How can I feel safe as I get moving again? And what kinds of movement can help with chronic pain? To start, we'll look at what science says about the relationship between movement and chronic pain. Many years of research show that exercise is just plain good for you. It can help manage or prevent heart disease and diabetes. It keeps bones and muscles stronger. If you exercise regularly, you're likely to have more energy, think more clearly, and feel less depressed or anxious. You'll probably sleep better too, but you probably already knew this. What you may not know is that regular exercise is recommended for dealing with chronic pain as well. In fact, research shows that exercise is a critical part of a chronic pain management plan. Exercise can make it easier to do ordinary things like get dressed, shop, or prepare meals. And by releasing your natural pain blockers, called endorphins, exercise can also help reduce pain. For people with chronic back pain or fibromyalgia, exercise can improve mobility and reduce fatigue. For people with arthritis, exercise helps protect joints by improving their stability. It helps control pain by keeping cartilage and bones healthier too. You don't have to work out like an Olympian to see these benefits. Brief periods of moderate physical activity, like a brisk walk or light biking or swimming, are enough to do the job. This is true for older people as well as people with disabilities. And yet, for people with chronic pain, starting even a gentle exercise program may seem as out of reach as running a marathon. If you've tried exercising and felt uncomfortable, or noticed an increase in pain afterward, you may have decided that it's just not for you. It may seem as if resting your body is the only thing you can do. Rest is essential, especially for people with chronic pain, but avoiding movement can set off what's called a cycle of deconditioning that can make pain worse. It works like this. Fear of pain makes you avoid physical activity. You may use what are called guarding behaviors, such as tensing up or avoiding certain movements completely. Lack of movement causes your body to become deconditioned. That is, your muscles and joints begin to lose strength, stability, and range of motion. That triggers more pain and makes you more prone to injury, and more pain causes you to restrict your movements further, and the cycle begins again. So, there's such a thing as too much rest. Researchers demonstrated this in a big way in 2004 when they studied patients being treated for acute back pain. The patients who stayed in bed for 4 days or more were more likely to develop chronic pain. They also needed more pain medication than the patients whose treatment included movement. This is one reason doctors no longer routinely recommend bed rest for low back pain. Stopping the cycle of deconditioning and pain means finding ways to maintain and gradually increase your strength. That may mean training your brain to respond differently to movement. Let's review what you've learned so far with a short quiz. Question 1. True or false? Exercise is an essential part of a pain management plan. A. True. B. False. The correct answer is A. Exercise is essential, even for people with chronic pain. Regular exercise can help strengthen muscles, improve flexibility, and manage pain more effectively. Question 2. What happens in the cycle of deconditioning? A. Fear of pain makes you tense up and avoid movement. B. Lack of movement causes you to lose strength and range of motion. C. Losing strength and range of motion make you more prone to injury or pain. D. All of the above. The correct answer is D. Fear of pain makes us avoid movement, and this causes us to lose strength and range of motion and makes us more prone to injury or pain. Getting moving again means taking another look at the role of the brain in creating pain. If you've dealt with pain for a long time, your brain may have learned to resist any movement that might set off a new flare. This keeps the muscles in a tense, guarded state that's more likely to produce pain when you move. If your brain has become overprotective like this, it may actually interpret the sensations of normal, healthy movement as dangerous or painful. As a result, you avoid movement, but muscles that are underused are more prone to injury and pain, even when you're just walking, standing, or sitting for very long. Fortunately, we keep forming new brain connections throughout our lives. So, what your brain has learned, it can unlearn. One way to help your brain do this is by recalling this important fact. Pain is not always a sign of injury. There are many other reasons why the brain may produce or ramp up pain, including fear, stress, and memories of past painful experiences. Sometimes just keeping this fact in mind as you move can begin to reset your brain's pain alarm. Another way to retrain your brain is a mental exercise that many athletes and musicians use to improve their performance. It's called graded motor imagery, and it involves using your imagination. How can this help? Your brain contains a kind of map of your entire body called the sensory motor cortex. Every part of your body is wired to a specific set of cells in this area of the brain. These brain cells are responsible for how we move and what we feel in each part of the body. Studies show that just thinking about using a certain part of the body can cause these cells to activate. So, by imagining yourself doing a movement, your brain gets some practice at it. This helps the brain get more comfortable with the idea of movement and less likely to send protective messages that cause tension or pain. To do this exercise, start by browsing the internet or a magazine for pictures of people doing simple movements that you'd like to resume, such as bending, reaching, holding, lifting, or walking. Looking at these pictures may make you worry or tense up a bit, but ask yourself, can just looking at a picture or thinking about a movement hurt my body in any way? Of course, the answer is no, but asking this question allows the conscious part of your brain to tone down the fear and pain signals that the unconscious part is producing. Once you start to feel at ease with an image, try to picture yourself in that image. This is different from just wishing you could do the activity, and it's different from thinking about doing it. As much as you can, try to feel yourself doing the movement from start to finish. If tension comes up, try the square breathing exercise from Lesson 1 or the self-care meditation from Lesson 2. Then ask yourself again, can I actually damage my body just by imagining that I'm moving? Like all brain training, this exercise probably won't work immediately. You'll need to repeat it. But with a little practice, you may feel comfortable enough to begin expanding your comfort zone. Start small. For example, if you've stopped walking any distance out of fear that your pain will flare up, Try parking a little farther from the store next time you go. Gradually and gently increase your movements over time, and now you're on your way. As you begin to lower any fears you might have about movement, you can also start getting ready for regular exercise. If you haven't been physically active for a while, check with your doctor first, especially if you have a recent injury, a heart or lung condition, high blood pressure, a condition that affects your balance, or if you've experienced chest pain, shortness of breath, or dizziness during exercise in the past. Most people, even with multiple health conditions, can enjoy some form of physical activity. Your doctor can help you decide on a plan that's right for you and let you know about any special care you'll need to take. No matter your health history, there are a few things to watch out for as you begin new activities. Stop exercising and call your healthcare team right away if you notice that your heartbeat is irregular or normally fast. You feel pain, pressure, or tightness in your chest, jaw, arms, or neck, or you feel shortness of breath that lasts even if you take a break to recover. If you get dizzy or feel faint, lie down with your feet up or sit with your head between your knees. Talk with a doctor or nurse right away. As your body adjusts to the new things you're asking it to do, you may feel more tired than usual. That's completely normal. If you feel overly tired the day after exercising, rest for a day, then do a little less the next time. If fatigue continues, check with your doctor. Some new aches and pains are normal too. If you've been inactive for a while, your muscles may be weak or tight, and your joints may be stiff. This means that even very gentle activities are likely to cause some twinges at first. However, any sudden, sharp pain while exercising is a sign to stop or modify your movements. It's important to remember, though, that chronic pain is pain that lasts after your tissues are healed. And once your tissues have healed, gentle or moderate activity is very unlikely to cause any physical damage. In fact, our bodies are designed to become healthier with use. Even for people with degenerative conditions such as arthritis, research has found that exercise can lead to gains in strength and stability. If your muscles are a bit sore after exercising, let yourself rest, and remember that the aches and pains of muscle fatigue don't last. They're not signs of damage. They're a sign that your body is on its way to getting stronger. Let's pause again to review what you've learned. Question 1. What can happen when your brain becomes overprotective? A. It may keep your muscles in a tense, guarded state that's more likely to produce injury or pain when you move. B. You avoid using muscles, which become more prone to injury or pain because they're not being used. C. Both A and B. The correct answer is C. When the brain is overprotective, it can keep your muscles tense and guarded. You may also avoid movement, and both of these things make you more prone to injury or pain. Question 2. How can you help your brain get more comfortable with movement? A. By remembering that pain does not always mean there is damage to the body. B. By picturing yourself comfortably doing movements you may have avoided. C. Both A and B. The correct answer is C. It can help to remember that pain doesn't always mean damage. It can also help to picture yourself doing movements you may be avoiding. One size does not fit all when it comes to exercise, but experts do agree that gentle exercise at a moderate intensity is best for people with chronic pain. A complete exercise plan will support these 4 aspects of your overall fitness: your heart and lung capacity, strength, flexibility, and balance. You may need more than one kind of exercise to cover all these bases. Here are some ideas to get you started. Walking. If you're able to walk, it's a great choice for building cardiovascular fitness. That's how well your heart and lungs move oxygen through your body. Like your other muscles, your heart can become deconditioned if you avoid activity for very long. But as little as 10 minutes a day of walking can begin to rebuild your cardiovascular health. Walking is also load-bearing, which means that it can help strengthen bones. When you do walk, go at a pace that allows you to carry on a conversation. Choose a spot with a smooth path and places to sit if you need a rest. Try to work up to 30 minutes a day on the days you exercise. Swimming or water exercise is another great choice, especially for people with joint or back pain. Being in water can take strain off your joints, and warm water exercise can help relax tight muscles. Water exercise can also improve your muscle strength, flexibility, and cardiovascular fitness. Most pools offer classes for seniors and special flotation belts and other equipment for water-supported walking. Strength training can help counteract the loss of muscle mass that naturally happens as we get older. Stronger muscles help stabilize your joints, which can help control pain. And you don't need fancy weight machines. With a stretchy loop called a resistance band, you can build muscle strength right at home. If you've received physical therapy in the past, you may already have some bands. If you don't, they're easy to find online. Just be sure to start with thinner, stretchier bands. Fitness classes for seniors often include resistance band exercises. Before starting strength training, be sure to check with a physical therapist or exercise coach. Tai Chi is a dance-like martial art. Recent research shows that it can help seniors improve balance and avoid falls. Tai Chi is also fun to do and offers just the right amount of mental challenge as you learn the routines, or what they call forms. To start, find a Tai Chi class that's been specifically modified for seniors or people with physical limitations. Yoga is an ancient practice that more and more senior Americans are doing. The movements and poses of yoga can be adapted for almost anyone, even if you need to stay seated. Yoga helps with strength, flexibility, and balance. And the breathing practices taught in yoga can also be helpful for managing pain. Many yoga studios and community rec programs offer yoga for older adults. Look for teachers who've been trained in adaptive yoga or who offer seated yoga options. Many great videos for seniors are available online too. These ideas for gentle exercise are not the only ways to bring movement back into your life. Anything from dancing to ping pong that gets you moving regularly is a step in a great direction. You might have noticed the word gentle several times during this lesson. It's important to choose activities that are physically gentle on your body, and it's important to be gentle with yourself in deciding how often and how intensely you'll exercise. One pitfall on the path to recovery for people with chronic pain is something called the boom and bust process. It only gets triggered once you've started to feel a little better. And here's how it works. You start to exercise. Your energy level lifts a bit, or your pain backs off. You feel better, so you do more and tire yourself out. Your pain flares back up, and maybe at this point you say to yourself, I knew exercise was a bad idea. So you begin to avoid movement and start the deconditioning cycle we saw at the beginning of this lesson. The key to avoiding this trap is pacing, keeping a balance between activity and rest. Here are some other things to keep in mind as you get started. Make movement fun. The way to make exercise a lasting habit is to have a good time doing it. Try listening to music or an audiobook, inviting a friend along, or find a class to join where you can meet new people. Make a plan. Decide where and when you'll exercise. If you haven't made a plan, it's easy to let other commitments get in your way. And don't forget to plan rest days. Start small. Even 10 minutes a day can have a positive effect. Keep a record. Make a note of what you do each time you exercise. This can help with pacing yourself. And if you're overly tired the next day, having a record of exactly what you've done will help you know how to adjust the next time. Keep a notebook for this purpose, or use the movement tracker included in the packet for this course. Finally, once you have your doctor's go-ahead, don't wait to get started. We all know how this works. The longer you think about something, the more reasons there are not to start. So, let's take a very small and very gentle first step right now. We've invited Jill Johnson, a physical therapist and yoga teacher trained in working with older adults, to show you some simple seated yoga movements that are suitable for people with chronic pain. As a senior with rheumatoid arthritis herself, Jill uses yoga to maintain her strength and flexibility and her sense of well-being. Yoga also helped her recover from a recent hip replacement. Feel free to join in with Jill and do what you can. And if a movement doesn't feel right for you at this time, see if you can imagine yourself doing it instead. Even that can have positive effects.
Hello, I'm going to show you some chair yoga sequences. I have rheumatoid arthritis and atrial fibrillation, and I have found yoga to be both safe and helpful. Basically, if you have a body and you can breathe, you can do yoga. The poses are done with modifications for different issues and body types. Let's begin by looking at the breath. If you want to decrease anxiety, it can be helpful to lengthen your exhalation. So while we do the poses today, try inhaling through your nostrils and exhaling through pursed lips. Very gently, so you wouldn't even blow out a candle as you do it. We'll go through some of the movements of the spine. First of all, side bending. So stabilize yourself with your right hand, lean to the right, and sweep your left arm overhead. Feel how you open up the side ribs. If your shoulder feels sore, you can keep your hand on your hip and just lean to open up the side ribs. Inhale, come up. Exhale, and go to the left. The spine is also capable of rotating. If you're in a chair with chair arms, you can inhale, get tall. Exhale, hold on to the sides of the arms. If you have a chair like this, you can simply swivel to the side. Inhale, get tall. Exhale, turn to the back of the chair. Holding the sides allows you to twist even more deeply. So as you twist, you can think about wringing out the old blood and bringing in fresh blood. Inhale, get tall. Exhale, turn. You can do these poses several times. The other two actions are forward bending and back bending. To come forward, be sure you maintain the space between your ribs and your pelvis, so we're not coming forward like this. Instead, we're moving from the hip crease. Inhale, get tall. Exhale, lengthen forward. Some of you might want to rest on your forearms, or you can come all the way down, hands to the floor, and release your head. Inhale into your back ribs. Exhale and release. And then finally, The spine is capable of back bending. You can bring your arms behind you, lift your chest, look up towards the ceiling as you arch back. All right, hopefully you're already feeling a little bit better. And now maintaining this space, we're going to move the legs a little bit. If you feel like you would collapse as you lift the knee, just lean back into your chair to stay nice and tall. See how much you can lift your knee, and just working with motion allows you to lubricate your hip socket. Some of you might be able to hold the thigh to go a little deeper. And some of you might be able to lift, turn the hip, and place your foot on your opposite thigh. This gives you a nice stretch to the side of the thigh and the back of the hip. By looking at both sides, you begin to see maybe imbalances you have between sides. You get to know yourself a little better. So basically, just taking a few minutes a day to nourish yourself will help you share with those around you. And remember, yoga helps us to face the challenges of life and find that part of us that is stable and unshakable. Namaste.
To continue, say next. Congratulations! You've just taken another important step in your pain management journey and done something caring for yourself. So now what? Well, we haven't mentioned one final but essential part of every exercise plan, and that's rewarding yourself after you exercise. So have a cup of tea, put your feet up, or just take a moment to appreciate your own effort and the spirit of self-care that are allowing you to try new things and continue in this journey. What's on the path ahead? In the next lesson, we'll talk about more ways to care for yourself and keep the positive momentum going. In the meantime, you can find more information about chronic pain and exercise and some fun videos to try in the resources that accompany this lesson. Or just pop into the Elder Tree discussion group and share what you're thinking. We'd love to know, and we look forward to seeing you again. Bye for now.